let's discuss how to give advice in OET speaking. 1. Quit smoking. I'm glad you've made the decision to quit smoking. The good news is that it is possible to give up smoking. I would like to reassure you that many of the complications caused by smoking can be reversed. If you quit smoking, you will have more energy, better health, and improved sense of taste and smell. I suggest you reduce the number of cigarettes gradually, and aim to stop smoking completely within 2 weeks. Does that sound realistic to you? Don't worry if you feel irritable or tired or sweaty at first. After about 10 days, these unpleasant feelings will disappear and you will feel great. Let me give you some good tips for quitting smoking. It is best to have a definite date in mind to stop smoking. In order to quit smoking, I recommend that you attend our hospital's quit smoking program. They run regular classes, and I can tell you that it has helped many patients succeed in giving up smoking. Would you like to do that? It's a good idea to avoid smoking situations and do activities that can distract you from smoking. Another thing I would mention is that there are many supportive groups and programs available to help you to quit smoking. 2. Alcohol addiction. It is quite a serious condition, and you really need some outside support to help you overcome this. Therefore, I recommend that you contact Alcoholics Anonymous, or I can contact them on your behalf and arrange an appointment. How does that sound? 3. Starting insulin. I understand that self-injecting insulin can be challenging at first, but at our clinic we run weekly training programs which are run by our nurses. They can take you through the process step by step and help you gain confidence. Would you like me to make an appointment for you? You will have to roll the bottle of insulin well between your hands 2 times. You need to mix well, and please do not shake the bottle, as this will form air bubbles which will affect the amount of insulin withdrawn. Withdraw exactly the same amount of insulin as required into the syringe. Here, the insulin injection is being prescribed just as a precautionary measure, just to bring the blood sugar level to the normal position. 4. Care of wounds. Firstly, always keep the wound clean and dry. If you notice any swelling, redness or discharge, please get on medical advice. Don't forget to drink plenty of fluids. It is important that you get adequate rest and eat a healthy diet high in protein. As you know, it is vital that you wash your hands regularly and pay attention to personal hygiene. If you can, try to get some sun to your wound. If the wound develops a scab, don't pull it off as it may cause scarring. 5. Problems with memory. Firstly, I'd like to reassure you that memory problems are common. Secondly, memory can be affected by a range of things such as common illnesses, lack of nutrition, and aging. It may be helpful if I give you some tips for preventing memory loss. Is that okay with you? I have a brochure here which I will leave with you. It gives tips such as exercising regularly, which helps blood flow to the brain and also helps with anxiety. Try to eat plenty of fruits and vegetables. If you can manage your stress, this lowers cortisol levels, which can reduce problem with memory. Of course, getting plenty of sleep is also great to help with memory and concentration. If you are experiencing any signs of serious memory problems, then of course, don't hesitate to come back and see me and we will run some tests.